Breaking down the word thyroid orbitopathy, you are simply trying to say that what orbit is the eye, pathy is disease of the eyes, thyroid is thyroid. Okay, so that means like there's a disease of the eye, and this disease of the eye is caused by what the thyroid gland. That's the thyroid hormone. Okay, it will be that the thyroid hormone is too excess in the body, so it's not causing some eye signs like that. Okay, so those are the diseases of the eye caused by the thyroid hormone. So we'll be treating this from the perspective of the definition, talk about the characteristics, talk about the clinical features, then talk about the stages, talk about the possible treatments for what this thyroid orbitopathy, then talk about the complications. So for the definition, we said that this thyroid orbitopathy, also known as what thyroid associated ophthalmopathy, is an autoimmune condition that affects the orbit, that's eyes. Okay, and also it affects affects the eye socket and the surrounding tissue, or you could just say it affects the eye now. Okay, in people with thyroid disease, and typically you find it in people with Graves' disease. Talking about the characteristics of this thyroid orbitopathy, there's inflammation and swelling of the orbital tissues. There's expansion of the orbital fat and connective tissue. There's enlargement of extraocular muscles. There's fibrosis and scarring of the orbital tissues. Then, talking about the symptoms, right? Clinical features. All right, so the person's eyes will be so big, okay? Person's eyes will bulge out, right? Will bulge out. So the person's eyes will bulge out. Then around the eyes, there will be like gathering of fluid and all that. So that's periorbital edema. There will be chemosis, which is swelling of the conjunctiva. There will be eyelid retraction. There will be diplopia. The person will be seeing double, 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 double. There will also be sensitivity to light. Okay, there will be redness and inflammations. We've seen this already, right? Bulging, inflammation, dryness, pain, bloodshot, impaired vision, and the rest. Then talking about the stages of this thyroid orbitopathy, there's an inflammatory stage where there's active inflammation and swelling. There's fibrotic stage, that's after the inflammation is now what resolving, okay, you have a formation of fibrosis setting in. Okay, so now this one there's scarring and fibrosis of the orbital tissue. Then talking about the possible treatment of this thyroid orbitopathy, you could use corticosteroid just to reduce the inflammation. You could use immunomodulatory therapies just to suppress the immune system. You could use orbital decompression surgery just to relieve the pressure. You could use what eyelid surgery just to correct what the eyelid retraction. So eyelid retraction is more of like your eyelids are going back to the extent that they are exposing the white sclera too much. Okay, then you can use prism lenses or strabismus surgery just to correct the diplopia, because the person will be seeing 222. Then the complications of this thyroid orbitopathy, if left untreated, it could lead to vision loss due to optic nerve compression, lead to corneal exposure and ulcerations, lead to a chronic diplopia, leads to facial disfigurement. So this is it about the thyroid orbitopathy, also known as what thyroid associated what ophthalmopathy.